Hello everyone, my name is Alina Lattimore and my topic is on gastric dilatation volvulus. So let's figure out what that is. And so the etiology behind gastric dilatation volvulus is a condition that mainly is seen amongst deep-chested canines where their stomach would fill up with some kind of substance like gas, food, or even liquids, and it would expand and then twist upon itself. This condition is related to torsions and bloat. And so, for the part of the name for gastric dilation volvulus, it's only fair to include what volvulus means for its definition. So, volvulus mainly means a loop of intestines twisting around itself and the mesentery in the stomach. The diagram below shows this happening exactly where it shows two dogs. One is a healthy one, and the other one is one that's affected by gastric dilatation volvulus, which I'll refer to as GDV throughout this presentation for short. And so the main causes behind this comes from giving a dog just one large meal a day, being an older dog, having a deep chest, and having a family history that has gastric dilatation volvulus. So having a deep chest is pretty much like the species, so to speak. Some researchers have done studies suggesting that dry foods with large amounts of oils composed in them could possibly increase the dog's chances of getting gastric dilatation volvulus. So this is mainly seen in large species dogs. And so you can also see that canines are the more largely susceptible species that will get this, especially the Great Dane, where you'll see that the chest is like the most dominant part of the canine's body compared to the rest of it. So that's pretty much a common composition that you'll come across when seeing an animal that has GDV. It also occurs in other animals as well, too, and in humans, but not so common. On the right is a picture of the stages of a dog getting GDV. So where it starts out as healthy, of course, and then later on, they're bloated. And then after that, you could see right here in this last picture, that's one of the final stages for GDV, where it's pretty much its intestines are twisted and the bloating has increased by a lot. If you can, look back at the very first picture and just compare the stomach size from the first and the last. It pretty much increases by like 4 times its original amount. Pretty scary, isn't it? And so many of the common symptoms with GDV include bloating, stomach pain, distended abdomen, lots of stretching and standing, retching, which is when, like, you see a dog trying to cough up as if it's trying to vomit, but nothing comes out, drooling, anxiety, increased attention to its abdomen, death if left untreated, collapsing, lameness, and panting. So for the transmission of GDV is that after a dog has eaten a large meal, the dog's stomach will begin to fill up with a gas, food, or liquid over a period of time. And so from our previous studies that we've done, we've seen that roundworms can also cause bloat. However, GDV is most commonly caused by eating a really large meal, though some studies have shown that roundworms could also be a factor in dogs developing GDV as well. And so dogs can get roundworms from getting in contact with other infected animals, infected stool, dirt, or soil. And so prevention and treatment for GDV includes keeping a well-rounded, safe, and realistic meal plan for your dog according to its age and breed. Also, be sure that you get routine checkups for your dog with veterinarians and dietitians. So in case your dog does get GDV, the best preventative care is trying to stop it while it's in its early stages. And so when you eventually come across that with your dog, if you're not, knock on wood, they say that getting early surgery is the best. However, the prices can be pretty hefty, stemming from $2,000 to $500 to $5,000. And so if that's too much money, if you can't afford that, then euthanasia is also an option as well. However, with GDV surgery, there's a 90 to 95% survival rate, according to your dog's age as well, to take that into consideration. The later that you wait to get treatment for GDV, not only will the canine suffer, most of its organs will also start to suffer as well with it, of course, including its stomach. So let's say if you brought in a dog that had GDV for a long time, and so it turns out that his stomach isn't working, the survival rate of it will go down by 50%. And you might want to possibly consider euthanasia as your option at that point. And so for the zoonotic status for this is definitely a no. However, its geographical occurrence, commonly seen in the United States due to them having a obesity problem with its animals. And so I looked up some of the cases. Well, I couldn't find any of the recent cases, so on one of the websites that I cited in my next slide, there was about 167 of those cases back in 2014. And thus ends my presentation. Thank you for your patience and have a nice day. Here's my works cited.